Hello and welcome to another episode of India Today's digital bulletin on all things Omicron in India and across the world. I'm Milan Sharma. First up, we're looking at the new tally of Omicron cases in the country. Now, India has breached the 100 mark of Omicron cases. India's, as of now, reporting 101 cases, and Maharashtra, Rajasthan, as well as other states such as Delhi are reporting some of the highest numbers of Omicron cases at the moment. This was informed in the Union Health Ministry's press conference and the weekly briefing that they do on Omicron cases. Apart from this, the ministry has also said that while contact tracing is on if these people who have tested positive are from international countries, but what's important to note is also that not all cases out of 101 cases had any international travel history. There was a question that was being posed on whether the Omicron is moving towards community transmission in India like it is in other countries across the world. Okay. Well, as Omicron has been surging, different states are trying their ways to restrict and contain large amount of gatherings. As the Health Ministry has also said that not one reason should be given for a gathering, and therefore in Maharashtra and Mumbai, Section 144 has been imposed to contain the spread of Omicron. My colleague Pankaj Upadhyay has more on this.
The government has decided that Section 144 will be in place in Mumbai till the midnight of 31st December. Surprisingly, the government has also said that no terrace parties in residential complexes will be allowed. No parties in residential premises as well. No parties, get-togethers or social meetings in Marine Drive Promenade, Bandra area or along the beaches as well. The government says that all its COVID care centers are in a state of readiness. The oxygen problem will not be faced this time around, and enough measures have been put into place. But the government says the onus lies on the people as well. Everyone will have to realize the responsibility. It is going to be a collective responsibility. Everyone will have to abide by COVID appropriate behavior, and especially if during the Christmas celebrations, during the New Year's Eve, if rules are broken, then strict action will be taken by the Mumbai police, the BMC and the disaster management force. With camera person Samir Shanbag, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
Well, it's not just vaccines that we are looking at to fight this pandemic. There are concerns about waning immunity because of the protection that is being provided by the vaccines is lowered because of Omicron. So there's a new concept of oral pills that's also being looked at by many drug manufacturers, and where we are talking, there is one such drug that's been made by Merck and another that's come out that's made by Pfizer. But can these be game changers instead of vaccines to cure COVID-19, especially in the light of Omicron? I filed this report earlier to explain how we can look at COVID pills as well as oral treatment.
COVID-19 is showing no signs of disappearing in the near future. Every time one variant plateaus, another emerges. In a world now reconciled to the coronavirus, the search for drugs to battle the newer form of the virus continues. Pharma firms are now finding ways to combat the super mutant variant. Among the top two candidates are Molnupiravir from Merck and Paxlovid from Pfizer. Merck claimed in November that relative risk reduction for people who took the Molnupiravir was 30% only, compared to its earlier findings of 50%. Pfizer has recently announced that its experimental COVID-19 pill seems effective against Omicron and claims to reduce combined hospitalization and death by about 89% in high-risk adults. The pills need to be taken shortly after initial COVID-19 symptom. It typically needs to be taken during the onset of the virus for 5 days. The US FDA's panel narrowly recommended Merck's drug for emergency use, with the caveat that it will be revoked if a better drug comes through. Despite molnupiravir's low efficacy, the UK has approved it. In the United States of America, meanwhile, an independent medical panel reviewed data and recommended that Pfizer continue the study to get full results before proceeding further with regulators. India's drug regulator has deferred the approval of molnupiravir as clinical trial data from companies remains inconclusive on the efficacy of the drug. 6 companies are involved in the making and marketing of the Merck's drug in India.
At this moment, we have found that they have to be given at a very early stage, even before the diagnosis is coming, and there is not the scientific data is still not supporting in such a big way that it will be useful at the moment.
Several low and middle income countries are awaiting a decision by the government, as Indian generic firms will be key suppliers of this drug to countries in Southeast Asia and Africa.
Amidst the fact that companies are working on an oral pill to cure COVID-19, the fact remains that the drug should also be safe. And how safe it will be shown by emerging evidence. But how will it be possible to market and give the drug in a country like India is also a big question, so that it's accessible to all. The government at this point is monitoring data on oral pills for COVID-19, which could be game changers if approved. With Hitesh in New Delhi, Milan Sharma for India Today. Well, now that we know we have another weapon to fight COVID-19, it's just a matter of time when India will also be looking at these antiviral pills and oral treatments for this infection. But that's all we have for you in this short bulletin on Omicron. There's much more in the next episode. Stay tuned to indiatoday.in.